Good afternoon, everyone, and welcome. My name is Molly Mitchell, and I'm the manager of the Mid-Atlantic Public Health Training Center. And on behalf of the Training Center and the Maryland Department of Health and Mental Hygiene, I'd like to welcome everyone to today's presentation, our May Public Health Practice Grand Rounds on Healthy Food Access in Urban Areas, Barriers and Solutions. And before I introduce our speakers today and get started, I've just got a few announcements to make. For those of you who are watching online, I'd like to invite you to please check out some of our archived Grand Rounds that are on our website, as well as some of our other online trainings as well. And I'd like to draw your attention to some of our live face-to-face trainings that are coming up, including grant writing and logic modeling. And just alert that next month's Grand Rounds is going to be on reducing asthma disparities in children. Also, for those watching online, please know that anytime during the presentation, you can email a question to either of our presenters by simply clicking on the link. And we also do ask that you fill out the sign-in form so that we can give our federal funders a better idea of who's watching and how many people are watching today's webcast. And so with that, I'm going to go ahead and introduce our speakers today, Ann Palmer and Holly Freishtat. Since 2006, Ann has been the Eating for the Future Program Director at the Johns Hopkins Center for a Livable Future. She's responsible for directing the food and nutrition work at the center. This includes identifying opportunities to build awareness about the current food system and its impact on public health and the environment, collaborating at a regional level with other institutions to determine the potential of regional food systems reaching underserved areas, working with Baltimore City's food policy director on improving food access in Baltimore, and facilitating community food assessments with community organizations. Prior to this position, Ann worked for 13 years developing and managing strategic communications and large-scale health communication campaigns and programs in Asia. She holds a Master's of International Affairs degree in Communication and Development Studies. And our second speaker today is Holly Freishtat. Holly Freishtat is Baltimore City's first food policy director. In this role, she created the Baltimore Food Policy Initiative and intergovernmental collaboration that aims to increase access to healthy, affordable food in food deserts in Baltimore City. Ms. Freishtat has spent over a decade working on food issues in a variety of contexts, including work on food and health policy as a Food and Society Policy Fellow, and at the Washington State University King County Extension, where she founded a farm-to-school program and developed the program's gardening and cooking nutrition curriculum. Ms. Freishtat also worked for Skagatonians to Preserve Farmland, where she developed a farm-to-healthcare pilot project that provides healthy, seasonal foods to hospitals and retirement communities while creating new markets for farmers. Ms. Freishtat has a Master's of Science from Tufts University in Food Policy and Applied Nutrition and was a Food and Society Policy Fellow in 2007. So with that, I'm going to turn the floor over to Ann Palmer. Thank you.
Good afternoon, everybody. I'm thrilled to be here today, and I just want to thank Molly for inviting us both to come down. As she said, I work at the Center for Livable Future. We are an interdisciplinary center in the School of Public Health, and we really look at the intersections of public health, the environment, agriculture, and food. And so a lot of our work is looking at the systems, even though today we're going to be talking primarily about healthy food and healthy food access. So why do we even talk about food? And I think one of the things that I've noticed since I've been working on this topic area is that, we have treated a lot of different services in city government, such as water, air, food, shelter, et cetera. Except for food, we have treated those that they need to be attended to and regulated in some way. And so I think one of the things that we see with the increase of diet-related disease is that food has primarily been in the private sector. And we've sort of left it there until certain trends started happening, and we realized that maybe this needed to be considered more as a service or as a good that the public has to have access to. And so I think what you're seeing, there's just been a boon in literature and research and activities going on around the country around food and what's going on with our food system, in large part driven by the obesity epidemic, but by other reasons, for other reasons as well, is that there is an attempt now to try to structure food and to attend to it in a way that we need to do it from a policy perspective and an environmental perspective as well. So I want to talk a little bit about some of the current trends and what has changed in our food system over the past probably, I'd say, 30 to 40 years. And then I'm going to talk specifically about how some of these play out in urban areas. But I think overall, think about going into a store, any store, and it is unlikely that you're not going to find food of some sort. I have noticed food in auto parts stores, libraries, any possible store you could go into has a food display. So we have tons and tons of opportunities to be eating all the time, continuously. We have more food available now than we've ever had available. So really, you don't ever have to be hungry. I think the other thing you'll notice in our food system is that we have an abundance of the types of food products that we are developing. I don't mean different varieties of carrots. This is really more processed food. So if you were in a grocery store in the 1970s, you'd find about 8,000 food products, and now you find about 48,000 food products. And so those are really much more processed foods than we ever had access to before. The other thing that's happened is you see a big increase in serving sizes, and because people are eating out more, that actually has a bigger impact in terms of the number of calories they're taking in. Throughout the presentation, I'm going to talk about what some of the barriers are to people accessing food in urban areas. And I'm going to look at it from a perspective of physical barriers, economic, social, and educational barriers. And where it's feasible to do that, I'm also going to talk about some of the Baltimore-based research that has been generated on these topics. Before I do that, I do want to introduce you to some concepts and just some definitions that we're going to be using throughout the presentation. Food security is really just, do people have sufficient food to live? Do they have enough food? Are they experiencing hunger on a regular basis? If you are a food secure individual, there is some point in the course of a month or a year where you don't have adequate access to food and you're experiencing hunger of some sort. So food security and insecurity are concepts that are generally well known in our field. The other definition is something we call community food security, and this is a much more holistic definition about what's happening at that community level with regards to food. And so you look at not only is there just food there, but what's the quality of the food? Is it nutritionally high in quality? Is it culturally acceptable? Where's the food being grown? Where is it coming from? How's it being transported? How much participation do the people who live in that area have in getting their food? Or are they just going to, this one store that happens to be located, 2 miles from their house? So it really is an attempt to look at what's happening at that community level, and recognizing the household level is important as well, but looking, trying to back up a little bit and saying what's happening in a community with this. And then when we use the term food environment, we're really just talking about any source of food that exists in a given area, a community, we could say, in a geographic area. So it's restaurants, gas stations, food stores, supermarkets, corner stores, anything like that is part of that food environment. So what's the food situation in Baltimore? So I think we have a pretty interesting situation. I'm sure a lot of you have heard the term food deserts before, and I'm going to talk a little bit about that. Holly will talk about that more in detail. But I think what you'll see happening in Baltimore is if you live in a lower income community, that the food that you have available to you isn't necessarily always the best quality. There's a lot more processed food, a lot more fast food, and in some cases the food is also not very affordable. Our food insecurity rate in the state of Maryland has increased pretty dramatically. I just updated these statistics. Used to be about 9%, and we are now up to 12.5%, and that's a steady increase since 2008. And we have households of 5.1% that have experience hunger on a regular basis, and that was about 3% just a few years ago. So we really are seeing the effects of the recession and the economics impacting people and their ability to get food and to be food secure. And you'll see that we are still lower than the national average, but we're climbing, unfortunately. In addition, you will find that even poverty isn't necessarily a predictor. You find a lot of people living in poverty that are not food insecure, but that definitely is there's this pretty strong relationship. So I'm going to talk about physical barriers now and think a little bit about the built environment and how that impacts people's ability to get healthy food. For each of these bullet points, this is typically a study, one study that's been done. And you can, as you know, for being researchers yourself or people who have studied, that you can, for every study you can find that says one thing, you can find a study that says something else. So you're going to hear some contradictions in what I'm saying, but just kind of bear in mind that this is just to give you some sense of the complexity of looking at these systems. So if you see a headline in the New York Times that says, you know, this is not a problem, this study shows that it's always important to dig deeper and, you know, figure out what are they really trying to measure there, because I think you'll find that there's evidence depending on how you measure it. So this particular study, it looked at if you added a supermarket, did it have a change in the consumption levels and fruits and vegetables of produce? And in one study, they found that it is up to 30% more that consumption increased, and this was among a group of African Americans in a low-income neighborhood. You also find that if you have a low income, you're designated low income and particular zip codes, that you're going to have fewer supermarkets in your zip code. Again, by design, it's more like, and this is more looking at what's the relationship, you know, how often, what's the density of the food stores there. A newer study that has come out breaks this down a little in a little more granular way that I think is really important to look at. So if you don't have a supermarket, and then you do have a supermarket, so you're changing that food environment, that becomes a source, that supermarket is a source for healthier food. However, if you're somebody who has access to a lot of different supermarkets, having more access doesn't necessarily make it a healthier food choice. It makes it somewhat unhealthier. And so you have, then it ends up being kind of a dose response almost. You're getting so much food around you that you're not making different choices. And what they found in this particular study, that if you were now shopping at a supermarket versus perhaps a smaller corner store or grocery, that you were increasing the number of purchases you made for produce. We also have a situation in Baltimore. I think we have 44 supermarkets in Baltimore. Is that right, Holly? So 44 supermarkets. And what we know about those supermarkets is they're very different. If you go to a supermarket in Roland Park and you go to a supermarket in Southwest Baltimore or in East Baltimore, what's inside that supermarket and the quality of that market varies dramatically. And so one of the issues, this research that I'm referencing right now is actually funded by a Center for Livable Future innovation grant. Dr. Franco had published this, and so a lot of the data is going to be coming from that. But what he found is when you looked at the food that was actually in the store, and he gave this a score using a particular measurement tool called the Nutrition Environment Measurement Survey, came up with an index score, and those scores for supermarkets in low-income neighborhoods were about half if you were in compared to a predominantly middle to high income white neighborhood. So it really does make a difference in terms of where you're living, in terms of what you have access to. And even within this, I found rather fascinating, even if you were looking at a chain market, so if you had a Safeway store in Baltimore City and a Safeway that was out in the county, there would still be a fairly dramatic difference in the healthy food availability score. So it is not consistent across chains, and they actually do really market to those neighborhoods what they think is going to sell and what they think people want. If you look at diet, then this is a relatively, this was again from the same data set. I've now since read data that has said this maybe isn't as strong a predictor, but certainly in Baltimore, this was using the MESA data set, which is a cardiovascular disease data set of like 900 patients in Baltimore. And when Dr. Franco looked at this, he found that those patients had a lower quality diet than people, if you lived in a low-income neighborhood and had low healthy food availability, than people who were living in middle to upper income neighborhoods. So again, it's not only affecting purchasing patterns, but it's affecting consumption patterns as well. Now I'm going to talk a little bit about economic barriers and what happens. And as you can imagine, if you're a supermarket, you aggregate a lot of your purchases, and so you have volume buying and you can offer people much better prices. If you're a small corner store, you typically are buying from a wholesaler, sometimes even going to maybe a big box store and buying those items. And so you're going to charge more because you aren't buying the volume that you need to have lower prices. So that's one way of explaining sort of the difference in what happens with prices. But I think even with that, knowing that, there still is probably some price inflation going on that we can see. Brookings Institute had done a study that looked at 132 food products, over 3,000, and found that 2/3 of them were more expensive if you were in a store that was under 10,000 feet. A small supermarket would be about 25,000 square feet. Some of the supermarkets now, they're closer to 50, 60, even 70,000 square feet. So just to give you some sense of size, these are really like more small grocers. And we had used some of the data that Dr. Franco collected to look at what the cost differences were in Baltimore. And we found that up to $1.30 more for a box of cereal, and then a half-gallon of milk was actually about 81 cents more. If you're living on a tight budget, that is a pretty dramatic amount to be paying more for. The other study that I'm a co-author on that's going to be published in the next couple of months is a supermarket study looking at how people make decisions. And when people are factoring in how to shop and where to shop, the other things they are going to cost out aren't just going to be the cost of the food, but they're also going to look at how long does it take for them to get to the store, what's the cost of that transportation. And spoilage and waste is a big factor. If they're going to a store that maybe the quality of the produce isn't so great and it might only last a few days, that can be a bit of a problem. Are you going to buy your produce there, or are you going to just not buy produce because the chances are it might go bad before you need to eat it? So that becomes part of those economic barriers that people calculate in when they're making food decisions. We did a community food assessment in Southwest Baltimore back in 2008, just to give you an idea of how the money gets divided. And on average, this is about 147 people I think that we talked to in the Southwest neighborhood. There were 2 markets there at the time. On average, in a month, they spent about $280 at the supermarket, but they also spent about $140 at the corner store, which is pretty significant. So if you think about walking into a corner store and spending that type of money, what food is available to you, it's pretty poor quality for the most part, and there are a lot less options. What we tend to find in terms of patterns of shopping is that people will go once a month, maybe twice a month, to a larger supermarket and do the bulk of their buying, and then they use those corner stores and smaller markets to fill in what they need. And it ends up being not an insignificant amount of cash when you're on a budget. This is one of my favorite topics, food marketing. And I identify this as a social barrier because I think it does really affects our social norms and how we eat and where we choose to eat. And, I always like to think that I'm too smart to be pulled into marketing and nobody's going to pull it over on me. I'm not going to buy something because they said that. And yet I find myself oftentimes going, oh, maybe I'll just try this. So I think it is not, this has a huge influence on the way we shop and how we shop. And, they're spending, lots of money gets spent on this to study humans and what their behaviors are. And what we have found, one of the studies that showed that if you looked at shows that were deemed African American in terms of the audiences they were reaching, that they had, more unhealthy foods were marketed during that time, and that there were just more food commercials in general. And another study looking at low-income children and how much they watch TV, and that they do have more exposure. And so again, this goes back to the dose response of the types of foods that you're being regularly exposed to from a marketing perspective can be dramatically different. And you don't really see commercials for fruits and vegetables. I mean, there was, raisin commercials I think years ago, but that's about the extent of it. We eat a lot of our calories away from home, and because of that, we have to look at restaurants and fast food restaurants, sit-down restaurants, et cetera. I think some of the more robust research we're finding now, because people are starting to realize that we aren't really, yes, there are a lot of people going back to cooking, but in fact, a lot of people still don't cook, and they're spending a lot of money, out. That the fast food issue and the zoning issues around those and the density of fast food has become a big topic to be studied. So these are some of the newer studies that have come out on this. So if you have a fast food restaurant within walking distance, and I think in some of the studies, I'm not sure what the measure was for this first one by Dr. Lee, but in some of the studies they were saying if it was within a mile of your house, you were much more likely to have a diet that was higher in fast foods. So it's just that convenience factor. It's there. You have more opportunities to shop there or buy food there. In general, the other thing we find is that low-income areas have more access to all types of food. And so everything from sit-down restaurants to fast food restaurants to convenience stores to grocery stores. I mean, this is a relatively new finding. So it isn't, again, I go back to the quality of the grocery store, what does that mean? But that they're densely populated with all kinds of food. And so if you look at it from, again, a dose response, you've got lots of opportunities to be eating all the time. And then they did a little bit of modeling on this last study that looked at the availability and what would happen. And it seems as though if you had some kind of, and I don't know how you would do this, maybe Holly has some ideas, but if you have some kind of protective barrier in terms of like how far away should those fast food restaurants be from residential areas, could you actually lower consumption in some cases? And they do think that if you wasn't as densely populated with some of these stores, the opportunities to lower consumption rates could be quite significant. Again, more on the social barriers, what you'll find is disparities between populations. So if you're an African American student living in an urban area, you're going to have a much greater exposure than your white counterparts. The chain restaurants in low-income neighborhoods tend to be more unhealthy, and this had to be using what I would consider, there's like a nutrition environment measurement survey that's done for restaurants as well. The restaurant issue gets a little dicey sometimes when you're talking about measurement, because I don't think there's a lot of evidence that sit-down restaurants are healthier, but somehow they've been deemed healthier. I think you can eat probably just as much, and calorie-wise, I don't know that there's any evidence, but there seems to be some understanding out there that perhaps you have more options, and so you would have healthier options than you would at a fast food restaurant. And then the other part of that is the last bullet is talking about the sensitivity to cues and just the presence. They did find that if you looked at low-income residents and having access to all these fast food restaurants, that you had greater exposure, greater opportunities to eat, but that finding actually was really significantly true for men, but not nearly as significant for women. So that's kind of an interesting, and I think this was also, across age ranges, this was true. Women maybe are cooking more. They didn't really hypothesize, but I think that's probably what you're seeing more of. Then just looking a little bit more at social barriers and what happens when we get introduced to certain types of foods at a really young age. So if you're growing up in a neighborhood and you have a lot of exposure to fast foods and unhealthy foods, those tend to be, fried foods, whatever, they tend to be the foods that you know as your food. And that becomes part of your food culture. And it is very hard to change people's food culture. I think you have to be very deliberate about it. You have to have a lot of agency and wherewithal and resources in order to shift, your eating habits. And I think one thing that we don't talk a lot about in food system studies is taste. You get accustomed to certain tastes, and those taste good to you. And let's face it, if you have a bag of chips in front of you and you have an apple in front of you, I immediately go, oh, I should have the apple, but what I really want are the chips. So if you don't have those apples in front of you, maybe you're not even eating those. Maybe it's this kind of baked chip versus a fried chip, that those are the tastes that you begin to know, and they become the ones that you want. And again, that's a really tough thing to change. And I think they certainly know in terms of studies introducing kids to healthier food when they're younger, their ability and their taste buds, they actually become more accustomed to those. This goes back to a little bit more of the social barriers in terms of what we look at in terms of the disparities in general. We know that there are disparities amongst low-income populations and middle and upper income, and that can go everything from education and literacy to time available to just daily stress in your life. The less you have sort of a social fiber and a social network around you to help support you in any of your life activities, the less likely you are to probably feel like you have the opportunities to make changes or do things differently. Time, many low-income people are working and sometimes working more than one job. Time cooking becomes a very big barrier. One of the things there, the Thrifty Food Plan, which I believe is used by USDA to help determine food stamp benefits that we call SNAP benefits. And they say that based on what they allow people and what's allocated to them, they should be cooking 14 hours a week. So in reality, most women, if you look at a nationally representative population, cook about 7 hours a week. So that's even a greater disconnect when you think you add the other things into a low-income person's lifestyle and what they're having to do in terms of childcare, and if they don't own a car, they're taking public transportation. The chances of them cooking for 14 hours a week to be able to fill that, thrifty food plan are probably pretty unlikely. So that becomes yet another barrier. Then I'm going to talk about educational barriers, and this is there's some interesting findings with this, and some of these have come out relatively new, but we know that education level does impact how people choose to shop and what they choose to buy. What I think is probably less clear is that which comes first. Is it because those unhealthy foods are there and they're cheap? And just how cheap is cheap? Do they have the extra income to spend more on healthier whole foods? So it's not clear, really, I think, what direction that's going in. So yes, they have unhealthier food purchasing patterns, but what's actually driving those purchasing patterns? And I think there's a lot of things that drive it. We also know that if you give people a little bit of education, nutrition education around food choices, that they do make different choices, and they do a lot. They change shopping patterns. They're more likely to try new foods. You're increasing purchasing and consumption. You see increases in consumption. But that isn't necessarily going to always be enough, because there are a lot of other things that factor into how they make their decisions. And I think one of the things we're learning on this supermarket study is just how complicated it can get, and where are those levers that you can push that are maybe a little bit easier to tip it over that line versus something that's going to be a very dramatic shift. Can you get people to purchase entirely new types of food, or is that even necessary? Is it more about what's a healthy, affordable food, and then how can they take that food and create a healthier meal versus, you need to buy a lot more of these foods that you've never tried and maybe aren't as familiar. So there's probably a sweet spot in there that I hope we're going to find with our supermarket study. But right now, I think we know obviously information is not enough. It really needs to be more. And then this, I think I've kind of covered already, is just that, I believe environments really do have a lot to do with, how people choose to shop. Even if you walk into a store and see what's immediately available to you, what's available at eye level, what's available at the cap aisles, all of those are very strategically located within a store to make you want to purchase those items. Most of the time, those items are not healthier food choices. And if you're in a neighborhood that already has a supermarket that isn't selling particularly a lot of healthy food, you're going to be prone to it. You're going to see a lot more food items in there that are not healthy. And so your opportunities, again, are going to be much greater than if you're in a supermarket that doesn't have as many of these processed food products. And then last, this other, I think, is just, I've covered this, is just the strategies that people use to kind of overcome these obstacles. And our paper hasn't been published yet, but it'll be coming out soon, so hopefully I'll be happy to share with anybody who's interested. But this does really look at, from a qualitative perspective, how these decisions are being made. And so I think that's the end of mine. I'm going to turn it over to Holly, and I hope given you guys some appreciation for just the system that's in place that makes our food choices difficult. There we go. Makes it difficult for people in low-income areas. So thanks.